When I see teenagers with anxiety disorders, I know I've got a couple of things to do. I've got to help them with their anxiety, just manage those basic symptoms. But the other thing that I have to do is I have to do some psychological rehabilitation because many of these youngsters have been inhibited, withdrawn, avoidant for years, and they've actually developed a kind of anxious lifestyle. So they're fearful of situations, they are uncomfortable in a variety of situations, but they and their parents and the schools that they go to have kind of accommodated to that. And for those youngsters to have the very best results, they need to get rid of their anxiety, if you will, their problematic anxiety, but they also need to undergo significant behavior change to get back on track and to be able to function at their very best. That's a process that makes teenagers tougher to treat with anxiety, and a really good reason why you want to identify children early and get to them early. So, in that adolescent anxious population, there's a group of children who actually anxious makes them distressed, and when they're younger, they often kind of send out distress messages. So, crying, tearfulness, emotional upset. Sometimes it actually moves into temper tantrums or kind of aggressive upset, if you will. And those kinds of reactions to anxious stuff initially work to draw the teachers in, draw parents in, and unwittingly, people who react to that and make accommodations to the child as a result of those kinds of reactions reward that reaction, if you will, and facilitate its perpetuation over time. So I call that catastrophic reaction. These are very strong emotional reactions. They look like emotional meltdowns. In young children, it can be curling up into a ball, it can be tearful episodes. In teenagers, it really looks more like existential distress or psychic distress. There can be a lot of demanding behavior during that period of time. It can look a little, old fashioned word, hysterical, if you will. Um, the medication doesn't work particularly well on that. The medication works on reducing the anxiety burden, but kids and families really need to understand that that kind of catastrophic reaction to feeling anxious is something that gets learned and developed over time. And then it's going to really require some behavioral undoing, if you will, to get that back under control again.